evening and thanks for joining us. I'm Mitchell Ringos. The Special Investigations Unit has concluded their investigation into whether the discharge of anti-riot weapon Enfields at a 32-year-old man at the end of July in Thunder Bay was lawfully used. In the afternoon of August 11th, police responded to reports of a man wanted in connection with a murder investigation. Officers contained the residence, cut off traffic, and told people in the vicinity to stay in their homes. Also on hand were emergency task unit officers who assumed positions around the house and its two entrances. Over the course of hours, the man exited and re-entered the home several times, telling the officers he had a firearm and that they should shoot him. During one of the times the man exited, he was struck multiple times by armament rounds fired by two officers. Shortly after, the ETU entered the home and used a taser to immobilize him. The SIU then investigated the case, with Director Martino determining there were no reasonable grounds to believe that either officer who discharged their armament was anything other than lawful and that there was no bias for proceeding with criminal charges in this case. The file has been closed. Meanwhile, Thunder Bay Fire Rescue responded to multiple structural fires early this morning, with the first at 3:50 a.m. on the 200 block of Ambrose Street, where a garage at the rear of the structure was found to have a fire contained within its walls. That fire was quickly brought under control by the first arriving pumper crew, and just 30 minutes later, crews responded to another garage fire on the 100 block of Windermere Avenue North, leaving extensive damage to the garage and the two vehicles inside. No one was injured, and a cause of the fire has not been yet identified. As a Russian victory over Ukraine seems increasingly distant, some of Vladimir Putin's harshest critics are calling for him to be put on trial for war crimes. Judy Trin reports.
In Donetsk in eastern Ukraine, residents pick up the pieces after homes and university buildings were damaged in another barrage of shelling by Russian forces. This is the fourth time the city has been hit since the summer. People just need some rest in life. That's all we want, said this woman, whose friend was killed in the most recent attack. As Russian forces retreated, they have left behind mass graves in several cities. At this year's Nobel Peace Prize ceremony, one winner, representing the Center for Civil Liberties in Ukraine, said that justice and accountability for Putin's victims can only be achieved if he's tried by an international tribunal.
All these atrocities which we now face in our country is a result of direct impunity which Russia enjoyed for decades. Because for decades, Russian military committed war crimes in many countries of the world, and they have never been punished even for the horrible things that they have done in Syria. They believed they can do whatever they want. And now we must break this circle of impunity.
10 months into the war, the Ukrainian military has liberated cities under Russian control, but Putin's resolve isn't broken. Judy Trin, CTV News, Ottawa.
Local dental clinics that serve walk-in clients say the new Canada Dental benefit will help a lot of children without private insurance plans, but they also say it highlights the unmet oral health needs of thousands of other local residents. Jessica Clement reports.
The federal government introduced the Canadian Dental benefit in November. It will offer up payments to support care for children under 12 who aren't covered by private dental plans. Families earning under $90,000 per year are eligible, and depending on income, families can get between $260 and $650 per child. Carolyn Tate, manager of oral health programs for the Thunder Bay District Health Unit, says while it's not a significant amount of money, it will cover some basic care or allow families to purchase oral health tools like toothbrushes and toothpaste.
It also allows families that are on publicly funded programs like Healthy Smiles Ontario to be able to spend additional funds for their children, use it towards additional preventive services. Things such as braces are not covered through the provincial program, so families could use towards that type of service.
Confederation College Dental Clinic Manager Allison McMillan says there is a great need of dental care in the community. She adds that the dental clinic at the college has a high demand of clients.
We have approximately 16 new clients call each day that would like access to the care that we offer. We do our best to see everyone, but there is a very high demand for people to access this service.
The dental program is expected to expand to include those under 18 by next year, and all Canadians who will qualify by the end of 2025. Tate welcomes that expansion, saying there's a lack of publicly funded programs for low-income adults and seniors.
There is a great need there, so when the program expands there, it would be very helpful for those adults. And as well, we see a good number of low-income seniors. It's helpful in that sense when they will expand that to those demographics as well, but it's a great start that it's for children 12 and under, and for these first 2 years of accessing those small resources per child.
More information about the benefit and how to apply can be found on the government's website. Jessica Clement, TBT News.
Riverside Healthcare in Fort Frances recently announced the conclusion of their investigation into a privacy breach. According to the release, the Information and Privacy Commissioner has been informed, and any patients whose personal health information was inappropriately accessed are being notified. In a statement from CEO Henry Gauthier, Riverside revealed that a staff member inappropriately accessed patient electronic medical records, but asserts that the information was not disclosed or otherwise used by the staff member, and that immediate steps were taken to prevent further inappropriate access, saying, quote, Riverside Healthcare takes its obligations and responsibilities as a health information custodian very seriously, including its responsibility to prevent any inappropriate access, use, and/or disclosure of personal health information. It was announced earlier this week that starting Monday, pharmacists in Ontario will be able to prescribe Paxlovid for COVID patients. It's a non-injection antiviral treatment to eligible individuals. With more, here's CTV's Corey Nordstrom.
Starting Monday, people who recently became infected with COVID-19 won't need to book a doctor's appointment if they want medical treatment. Instead, they can visit their local pharmacy if it's opted in to prescribe Paxlovid.
We're a great starting point for people. We're more easily accessible, let's say, per se, than like a doctor. So if there's anything that we could do to help in that, I don't see why we wouldn't.
Pharmacies have had Paxlovid for months, but the amount administered has been relatively low. They expect the easy access nature of pharmacies will lead to higher uptake to the benefit of the public and the entire healthcare system.
Especially for people that are at risk, it's better to get treatment as soon as you possibly can. Things can get bad really, really quick. So by treating with the Paxlovid in the first 5 days, it improves your ability to get better quick.
Pharmacists will also be able to prescribe medication for 12 more minor ailments beginning January 1st. Among the 12 are dermatitis, hemorrhoids, and conjunctivitis.
You want to try to decrease the burden on the healthcare system, right? So if we can keep somebody out of the emergency room, for a minor ailment, that in itself is a victory.
The pharmacists say it's a natural progression as their job duties have grown in recent years. Although training was given by the Ontario College of Pharmacists, it's information they likely already know.
In our schooling, we're trained to treat those 12 minor ailments as well as other things. These ones are just basically things that are a little bit more common, so a little bit more that we'll see in the community pharmacy, and you don't necessarily need a physician to diagnose.
The added workload isn't expected to be a burden for these pharmacists, but they say it could mean more staffing is necessary to keep up with the increased responsibility. Corey Nordstrom, CTV News, Sault Ste. Marie.
Over the past 6 years, Leadership Thunder Bay has donated over $35,000 worth of holiday fixings to the Regional Food Distribution Service through their annual turkey drive. This year, however, a turkey shortage brought on by the avian flu forced organizers to go back to the basics.
Yeah, so about a week and a half ago, 2 weeks ago, we found out through Sean at No Frills, there's a little bit of a supply issue on turkeys this year. However, we rallied the troops and we are here to represent our 7th year and bring $3,000 to the RFDA, and I know that they will make good use of that for sure.
Turkey or no turkey, Leadership Thunder Bay will still able to donate over $3,000 to the RFDA, where the funds will be put to good use, purchasing holiday meals for local families in need. For Brendan Carlin, Community Service Manager for the RFDA, any and all help is greatly appreciated, especially at this time of year.
It's a real big help. This year, or well, any year at the holidays is really hard for people. People have to make choices, financial choices, and everything that we get from Leadership Thunder Bay helps make those choices a little easier.
A beloved Disney movie will be brought to life this week as the St. Patrick High School Grade 12 drama class will be performing Frozen Junior in person for the first time since the pandemic. It's been 3 years since St. Pat's Grade 12 drama class was able to perform in front of a live audience, and this year's students were ecstatic to bring it back. Frozen Junior features all of the memorable songs and characters from the animated film. Performances will start this Monday at 7 p.m. and run until Thursday, December 15th. Co-student director Jessica Smith says they've been working on the production since September, and she's excited to finally have people come out and see the show.
Frozen is an extreme spectacle, and it's a big doing, but I think that we've pulled it off so lovely. The characters come to life. We have a very talented group of kids, and we wanted to open up with something big and bold like this since COVID. Their last production was Elf Jr., and we want to make sure we have a good comeback.
I think they're just going to enjoy everything as a whole. There's a lot of singing and dancing, and I feel like the big numbers are going to be like the showstoppers.
I think for me it's just seeing these Disney characters come to life, and especially for the kids, they're going to be super excited, and we're just super excited to bring the characters in like real life for them.
All proceeds from the shows will be going towards the Northern Cancer Fund. Tickets are still available and can be purchased at the St. Patrick High School main office or at the door for $15.